Welcome to Recourse Coaching, where I help people rewire their brains so that they can live a better life. And you will see lots of different types of videos on here. A lot of it is also going to be movement, because that really does matter in how our brain works and how we are moving, and injury prevention. And so today I'm going to talk about runner's knee and IT band syndrome. A lot of people have runner's knee, so just basically pain in their knee. A lot of times on the outside, could be outside, inside, could be the whole thing. Sometimes their knee will feel like it locks up. And then IT band issues, which feels like some pain that goes down the side of the leg right here. We are going to talk about some of the things that might be the underlying causes of these issues to really help you start to get back to whatever that you want to do, and that you don't have this reoccurring problem all the time. First thing we're going to talk about is your feet. Most of us, because of the shoes that we wear, do not properly create an arch in our foot, and it's usually because shoes are too stiff, so they don't have a sole that bends. You should be able to actually fold your shoes in half. It's even better if your shoes are bendable enough that you can roll them up. So people will get things like plantar fasciitis, or it will be, you'll feel uncomfortable pulling on the bottom of your feet. You'll have Achilles stuff and everything if you are struggling with creating an arch in your foot. And people will tell you to wear stabilizing shoes. This isn't a good idea, because it's actually the stabilizing shoe that causes the problem. When we wear a stabilizing shoe, it does not allow normal foot movement. So all it does, it's basically like putting a cast on your foot. And you know what happens when we put casts on? You get muscle atrophy, tendons tighten, and then you're not using any of that properly. And once you take that cast off, you can't control any of your movement. So then now what we do with shoes is just give you a more stable shoe with basically a bigger cast to try and force your foot to do something instead of restoring natural movement. So the very first step to restore natural movement is to make sure that you know how to make an arch in your feet. If you cannot make an arch in your foot, this is what will happen. Every single time you're standing, your knees will often collapse in, okay? So just when I do this, I can feel knee pulling on my knees. All right, so we don't want the knee to come in. If you're running and your foot collapses, your ankle collapses every time because you can't create an arch, this happens. So actually, this is one of the things that can cause IT band. So the IT band is really straining of the IT band. It's pulling. And so if I normally run like this or walk like this, when I take a step, I have to come in, everything collapses, and then I'm pulling right here. There's also a crossover gait that contributes to IT band syndrome. And so that means you cross your feet over. When you run, which is pulling here, most people cross their feet over, have a collapsed arch, and run like this. This looks over exaggerated, but I work with runners all the time, and in their videos, you feel like, because I have a crossover gait too, you feel like you're not crossing over, but you are. And what happens is you'll see that your foot is underneath like the midline of your, like across the midline of your body, or like right here, instead of, if I were to step normally, it would be right here. Okay. People with a crossover gait will often sometimes get hit their ankle with their other ankle. And so they'll start to hit right here, or sometimes they'll hit their knee with their other knee as well. So what we really want to do is fix those arches so we can start to fix that whole chain of events that happens that could be causing foot pain, knee pain, hip pain, lower back pain. So the way to do that is to think of your foot as a tripod. Which means you want the pressure on your foot to be, really think of this whole spot here, your big toe, and right behind the fat pad, right behind your big toe, as one spot, and then it goes over to the side right here and to your heel. Okay, that's where the pressure should be on our feet. We always practice this just with standing, feet underneath your hips, toes facing forward, knees slightly bent. Don't lock out your knees or this will happen. Knees slightly bent, pull your belly in. All right. To make your arches, there's many ways to think about this. It is basically squeezing your glutes and your quads in order to align everything. So if you look at my kneecaps, if everything's not aligned, I let everything go, my kneecaps kind of come in. Screw everything nice and tight into the ground. So people say screw your feet into the ground. And then everything's in line. See how my kneecaps kind of come out to the side. The more you can practice it without shoes on or shoes that are more flexible, the better. Squeezing everything down here to get your knees and everything in the right alignment. And then your big toe should be on the ground. Big toe always stays down. You should be able to wiggle those 4 little toes. Put those down nicely. And then, so the pressure is big toe and then right behind the big toe over the side of the foot and then the heel. So what should happen is there should be a little pocket right here where your arch is. If you have had super collapsed arches your whole life, and almost everyone that is not genetic, that's because of shoes and that we weren't really taught to walk properly. So we can usually restore that. But in the beginning, you may not actually have a very big pocket, but you'll be able to see it, that it looks a little bit flatter than when you come here, okay? So really, you just, as much as you can, stand around and do this all day. And practice holding it. Because when we're standing, we should stand like this. We should never stand like this. We should never stand like this, like this. All of this stuff is collapsed. And then, so think if I stand like this, what am I doing to this one? Both IT bands are like strained in different ways, right? So, so are the ankles, so are the knees. So you really have to think about the way that you stand all day. All right, once you get really, really used to that, then you have got to keep that while you're moving, okay? So like we talked about more walking, if I come here and I lose all of that, everything's gonna come in, right? Pulling on the IT band, pulling on the knee, messing up my ankle. It's no fun. So you can practice being in your nice stance with your arches, taking a step forward, making sure the knee stays in alignment and that you don't collapse anything. Bring the foot back, step forward, step back. Don't do this. Okay, so forward and back on one foot, forward and back on the other. Okay, keeping the arch in both feet. So also don't let this one collapse. I could keep this nice arch and then let this collapse, which we don't want. All right, walk as much as you can around your house without your shoes on, trying to keep your arches. And then the next way that you want to practice this is to take something that a couple inches high that you will not slide on, put it on a surface that won't slide either. And then, because if I'm running, I'm usually, especially my cross-country runners, you're not running on a surface that's always completely level. So you want something that is a couple inches off the ground. You're gonna step onto it and step onto it with the other foot. You need arches the whole time throughout this whole thing. So the back foot needs the arch, even while the forward foot comes forward, right? And you're just gonna do these small step ups. One thing that you wanna look for, and we're gonna get to higher step ups in a second, is a couple things, and I just did it. Not doing this, popping the hip out, and also the knees have to stay straight. So what I'll see a lot is that the knees come in, and that's one way that you know that your arch collapsed or there's some other stuff going on. So try and come up and back down. Once you get used to doing it on a shorter surface, you're gonna get something higher, and then you're gonna do step ups as well here, and then come up and put your foot down, come back down. So you have to keep your arch throughout the whole thing. What normally happens when people do these looks like this. The other thing that we're going to talk about with being able to maintain arches through a movement is your toe bend. So you should be able to have a 90-degree toe bend right here, big toe, and then the pad that's right behind your big toe. So it looks like this. To test this, you come down on your feet and sit here and see if you can sit with a 90-degree toe bend. Most people end up here. Or, I mean, they could be, you know, their bottom could be anywhere, but they're usually very high up on their toes. Okay, so what you want to be able to do is sit back on your heels and have a toe bend with your feet right underneath your glutes here. Okay? The best way, rolling out the bottom of your feet and everything with the cross ball is very important. The best way to kind of train this kind of stuff, you could sit in a chair and do this, you could stand at a wall, just put a foot down and you come up and down, making sure that you're bending at the big toe, not bending out here. What people will do is get the little toes, but never be able to, and you need a big toe push off in order to walk and run properly. Once you get good at doing these on one foot, so again, 10 on one, 10 on the other. When you get used to those, you can do heel raises or calf raises, whatever you want to call them, where you need to come up and down. What starts to happen though is people do calf raises this way, where it comes out to the side, where I'm like out on my little toes, and you don't want that. So if you look at it from the back, make your arches, get set up, you're gonna come up and down. If you cannot bend your toe in the back, when you push off, when you run, you're going to need to turn your leg out, swing your leg over, and come forward, which also is one of the things that creates walking pigeon-toed, but also a crossover gait. Also IT band, remember, because if we are coming through, we have to turn the leg out. This also will cause hip stuff and bring it in. This is where we get the crossover, pulls on the IT band. All right, now, the other thing that's really important for both the runner's knee, ankle, IT band stuff, hips, is your glute medius. So you have your glutes in the back, right? Everybody does squats and things for that. But even with heavyweight squats, we are missing, for most people, working on the glute medius, which is right on the side here. So the weak glute med will contribute to a crossover gait, and a lot of people, it also contributes to when you see people run with like a hip drop, which if every time you hip drop, you're straining the IT band as well. Okay, so we want to fix all that, and there's a lot of things that you can do for the glute med, and I'm going to teach you one that's pretty easy to do at home. So because we are working here, we want to make sure that we are not too tight on the inner thigh, so you need a foam roller to do this. You are going to lay down, and we're going to roll the inside of the legs. So the best way to do that is to do this. You're going to lay down on your belly, foam roller is straight up and down here, and then bring your leg up like the number 4, put the foam roller underneath your leg. The biggest thing with this is if you lean back here, you're not going to get much pressure on this leg. So try and come forward a little bit, and then, so this should be about 45-degree angle this way to 90 depending on your hip, and you're going to put the foam roller underneath your leg. And then just shift your weight side to side a little bit. Some people come out and in. This can be extremely tight for some people. It can be a lot on their hips. If this is too high, find a foam roller that's lower, or a water bottle that's lower. So you're just gonna go up and down the leg, move an inch, and then go back and forth. A little bit more, back and forth. You're gonna go pretty far up to where your leg meets your body. The only thing is though, for some people, right where your leg meets your body, their hips may not be able to handle that. So work on what works for you. With foam rolling, it might feel like a bruise, like you're touching a bruise, but it should never pinch. It should never tingle. It should never feel like extreme pain, okay? This can also help if you have knee pain on the inside of your knee as well. So you're gonna do that for 2 minutes, and then you're gonna do the other leg. And then you are going to do some glute med side lying leg lifts. A little bit looks like Jane Fonda. But they're pretty specific, so we want to make sure that we do them correctly. You're going to lay on your side, and you can have your knees bent a little bit. I always put my hand on my hip so I can tell that I don't roll my hips forward or roll my hips back. Also, you can put your head in your hand, but if that really bothers you, and that's a lot, you can put your head on your foam roller here. Okay? I have headphones on though that go wrap around my ears, so I'm gonna move that. All right, so if I'm here, I have this nice straight line right here. My hips are straight across, and then I'm gonna be here. I'm gonna put my leg out, and don't point your toe on these. You're gonna be right here. So my leg is coming straight out from my body. You're never gonna go down here. It's always gonna be coming straight out from your hip. So I'm here. I'm going to internally rotate my foot, which means you're gonna point the foot a little bit down towards the ground. Once you're here, you're gonna lift up so you get this nice angle. Don't push it and go really high. You don't need to do that at all. It's just like a 45-degree angle here. Actually, I don't know what angle that is, but about here. Come down until your leg is coming straight out from your hip. up and down. None of this, we don't want to be rocking. Okay, you're here, up and down. They're not fast. Okay, so a few seconds up, a few seconds down. And you're gonna do 10 of them. And you'll feel it all right here. Those are my go-tos for everybody that I start them out with. They're the basics, and they're the things most of us all are missing, not through fault of our own. It's just something that we need to relearn again and strengthen again. The one thing that I will tell you with IT band, so people used to say to roll out your IT band, and it's not really recommended that helps recover the injury. So the IT band is painful usually because it's being stretched too far. When you roll on it, you're rolling on something that's stretched too far, inflamed, and all that kind of stuff. So for some people, they really like it and feel like, oh, I can always move much better afterwards and everything. So if you're using that and you know it works for you as part of, like, it helps you move better every day, then do whatever works for you. But what we really want to do is solve the underlying problem. So I hope that this helps you resolve any kind of knee, foot, hip, IT band issues that you might be having. If you want to know more about mobility and how to really take care of your whole entire body and start to really have proper walking, sitting, running form and everything, you can get my online program. It's called Reverse the Desk. I made it right when we started being quarantined, everybody was just sitting at a desk all day. And so it's a great 30-day mobility program that teaches you kind of everything you need to know to work on your whole entire body. Work out for you for every week, and you can switch them up and use those to do 10 minutes of mobility a day to keep your body working well, decrease pain, and the less pain we are in, the more our brain is able to focus on the regular stuff in life, like taking care of our kids, going to school, taking tests. I mean, my poor teen athletes that are like in pain and trying to take a test in school, it's just so hard for them because it's so hard to focus when you are in pain, not doing well, then you're probably worrying about your sport. And so same with all of my people that are working at their computer all day and their backs are hurting and they're not able to focus on their work. So this is a really great way to really help you function better in your everyday life. Go ahead and hit the subscribe button and get your notifications so you can get notifications when there's new videos from me. And leave a comment below if you have any questions or if you try any of these things, and let me know how you like them.